Good evening. It's Wednesday, the 5th of May. The challenges that lie ahead for India as the COVID-ravaged nation continues to report record levels of infections and deaths. What are the next steps for Prime Minister Narendra Modi, and how are the nation's most vulnerable coping? Hello and welcome to a special edition of The World. I'm Beverley O Connor. Well, India is staring down the barrel of becoming the nation worst affected by the coronavirus pandemic. Hundreds of thousands are contracting COVID-19 every single day. Those infected are finding themselves at the mercy of a health system that is crumbling under the sheer weight of numbers. Hospitals are well beyond capacity and the desperate scramble for oxygen tanks continues, victims left gasping for air. In recent days, at least 3,000 lives have been lost daily. The tragedy made worse by the lack of space for proper cremations. Empty public spaces and car parks are being used to build funeral pyres for the dead, many of whom are not even afforded their sacred last rites. So is India anywhere near the peak of this deadly second wave? And does the national government have a strategy out of this catastrophe? Those are one of the few issues we'll explore tonight. But first, let's take a look at how the country got to this point.
हमें देश को लॉकडाउन से बचाना है।
डर तो है कोरोना का, लेकिन आस्था पूरी है।
They are lowering the oxygen level, though it is needed, but it should be more.
It's saying that we are desperately in need in less than 1 hour and our pressures are dropping.
It is not about being let down. It is a collapse.
I get maybe around 50 calls every day. Somebody is asking for beds, somebody is asking for cylinders, somebody is asking for drugs. We don't have anything.
All flights from India to Australia will be temporarily halted.
इन लोगों को सोचना चाहिए कि यहाँ दिन रात डॉक्टर, स्टाफ, नर्स, वार्ड बॉय, तो आप सिलेंडर लगा नहीं पाओगे क्योंकि तुम उनको नहीं पता।
प्लीज सब लोग बाहर आ जाइए, पुलिस को कोऑपरेट कीजिए।
There shortage of vaccine, so there huge confusion.
सर थोड़ा कम है, गॉड का वो है, थोड़ा सा कार कम हुआ है थोड़ा सा।
Well, on the ground in New Delhi is our South Asia correspondent James Ocean. James, the past 24 hours has been the deadliest. Take us through the latest numbers.
Well, certainly the numbers have been bouncing between around 360,000 to 400,000 new infections every day. They are slightly lower than they were on the weekend, and the government's already trying to flag that maybe the peak is over. But we have to keep in mind that these figures are rubbery at the best of times here in India. The testing regime has been completely overwhelmed, so it can take days to get a test, even if you can get one in a place like Delhi, let alone the more regional areas where you simply cannot get a test. So we've got to take these figures as maybe indicative, but only when there's a long-term trend. You know, in a place like Delhi, there are some results that are saying that we are going down in numbers genuinely. For instance, the test positivity rate, that's the number of tests that come back positive. It was at 38% not long ago, but we're now in our third week of lockdown, so it's around 25%. So that's good for Delhi, but we are in our third week of lockdown, so there's bound to be some, I guess, drop in the numbers there. But the other part of all this is, of course, the deaths. Now, the death toll is not going to run in sync with the confirmed cases because it can take some time, a week or two even, for these serious, deadly symptoms to finally expose themselves. And the issue here that hospitals are saying is that they're not just at capacity, they're beyond capacity. There's beds in between beds, and that means there are people who are dying who should have and could have survived the infection, but they don't because they don't get the care they need. So this is very much an all-consuming infection that we have in India still. And we can see that it can breach any kind of bubble. We've got, for instance, the IPL, it broke that bubble. And now we've even got the Indian Foreign Affairs delegation. Their External Affairs Minister Jaishankar is in the UK for a G7 meeting, and he's now had to go into isolation because some of the delegation, the Indian delegation, has tested positive. So it's still a very all-consuming infection here in India, and it's not a time to celebrate at all.
Yeah. We've seen those horrible images of people desperate for oxygen. This has been one of the biggest issues, James. The supply or lack of it has now gone to the Supreme Court. What's happening there?
Well, it's strange that the courts are one of the battlegrounds against COVID, and you've got this blame between the Delhi government, which is run by a different political party, to the central government, or federal government, as we would call it in Australia. So they've been going at each other, blaming each other for the oxygen shortage. But one of the courts in Delhi has been saying to the central government that you need to hit these quotas. The Delhi government needs this much oxygen, and you're not delivering it. And so now that High Court, as it's called here, has basically threatened sedition, not sedition, has threatened to launch, I guess, legal action that the central government is ignoring the court's orders. We've now got an even higher court, a Supreme Court, intervening, saying, no, all this talk of legal action against the central government's not helping us anyway. However, it has put a deadline tomorrow for the central government to finally explain how it's going to meet Delhi's quotas for the oxygen that it so desperately needs.
Absolutely. James Ocean in Delhi, thank you very much for joining us. Well, let's now take a closer look at the state of infections across the country. And of course, as James just pointed out, there's central and state governments pretty much like we have in Australia. And state governments are doing different things to try and curb the spread of the virus compared to the central government. Here's Yvonne Young.
India's surpassed 20 million recorded COVID cases. That's around 1.5% of the population infected. But experts say the actual number could be 5 to 10 times higher than the official tally. According to government figures, these are the worst hit states. Maharashtra has the highest number of COVID cases at more than 4.8 million. That's 4% of the state's 126 million population. The state is where Mumbai, a city with more than 20 million residents, is located. Most of Maharashtra's 72,000 deaths from the virus are from here. Uttar Pradesh is the state with the largest population at more than 235 million, but it's recorded just a quarter of what Maharashtra has, with 1.37 million infections. Both Karnataka and Kerala states have tallies of around 1.7 million cases. In Karnataka, there have been more than 3 times as many deaths, though. India's capital territory, Delhi, has also been badly hit, with 1.2 million cases of coronavirus amid the 31 million population. Tamil Nadu has also had more than 1.2 million recorded infections, and Andhra Pradesh is not far behind. As for lockdowns, Prime Minister Modi has been reluctant to impose a second nationwide lockdown after the severe economic consequences of the first. He said lockdowns should only be used as a last resort. Well, at least a dozen states and territories are resorting to this. Delhi has extended its lockdown until May the 10th. Worst hit Maharashtra has banned non-essential activities and movement until mid-May. And Kerala has imposed a night curfew with only essential services exempted from it. The Jammu and Kashmir government imposed a corona curfew in 11 districts, and the curfew in Uttar Pradesh has been extended twice to curb movement in the most populous state. With these restrictions, it's hoped the numbers will start to come down. Some experts predict the peak of the second wave to be in the coming days.
Well, India's Foreign Minister has defended the lead-up to recent elections in the country, which saw mass rallies, and then there were other religious events being held despite this worsening emergency. Speaking in the UK ahead of that G7 summit, the minister says it was about upholding democracy.
People have spoken about elections. Now, obviously, we are a democratic country. You don't stop elections in a place like India. The only time I remember we stopped elections was an era which, some decades ago, when I was very much younger, where none of us really wants to be associated with that kind of memory.
Well, of the 9,000 Australians currently registered as wanting to return home from India, the number classified as vulnerable has climbed to 900. Australia's High Commissioner to India, Barkha Dutt, says that's up from 600 a week ago, and he says there would likely be a number of Australians currently in hospital with COVID-19. He doesn't, though, know the exact figure.
Within the vulnerable cohort that's registered in Canberra, there would clearly be, as well as across the 9,000 people that are registered with us, people that have either suffered in the past from COVID or may be infected currently. But again, all of our posts are identifying and saying to those people who are registered with us that if they have difficulties, please contact us so that we can do what we can to assist. To this point, other than a prominent cricketer overnight, where I've had an approach from a third party just to check on his welfare, we haven't had too many of those people contact us.
And that ban on Australians returning home from India has been challenged in the federal court. The government insists the measure is temporary and that it has sound legal basis. But lawyers for a Melbourne man stuck in India's south argue the government's emergency declaration is unconstitutional. Foreign Affairs reporter Stephen Jedget says we don't yet know when this case is going to be heard, and the timing is not clear given the ban is due to be lifted by May the 15th.
The grounds that have been put forward are basically constitutional one. The lawyers for the man who's challenging this, a 73-year-old man from Melbourne, Gary Newman, basically say that there's an implied constitutional right or an implied constitutional freedom for people to return home. And they say that the government has breached that in this order, which has not only paused all flights between Australia and India, but of course also proposed some pretty hefty penalties for those who break that law, including substantial fines and even jail time. Now, the Prime Minister has been at pains to say that he thinks it's very unlikely that anyone would actually be hit with those penalties. But nonetheless, Mr Newman and his lawyers say that the ban that's been put forward is legally not solid, it's on shaky ground, and they intend to challenge it, and they've lodged that application in the federal court. Now, as for timing, I simply don't know. Of course, the ban, we believe, is going to be lifted almost certainly on May 15. At least that's the indication that the Prime Minister and other senior ministers have given us. So is there really time for this court case to wend its way through the various legal chambers to reach some sort of decision before it lapses? I don't know, but on the face of it, it seems pretty unlikely. Nonetheless, there's clearly an important principle, an important legal principle at stake here, and Mr Newman and his lawyers are determined to pursue it.
Stephen, there's been some confusion in the aid we're providing to India. What have we managed to send them so far?
So the government has now essentially put one plane in the air. It's probably by now landed in New Delhi by now. And that's the first of at least 2 flights that will be carrying medical equipment to New Delhi from Australia. Now, the main thing that this plane is carrying is ventilators, slightly more than 1,000. Last week, the Prime Minister said it would be at least 500. We've now doubled that to 1,000, and we're told that it might be up to 3,000 in total that are going to be given to the Indian authorities over the next few weeks. On top of that, there's some other medical equipment. One thing that it's not going is some of the PPE, or personal protective equipment, that the Prime Minister announced last week. It turns out that some of those items, not all of them, but some weren't needed by the Indian government, presumably because they've been getting it from other countries, so that won't be sent. But look, the collective effort is quite a substantial one when you look at all of the different countries across the world that are now sending supplies into India. It won't be enough by itself to stop the crisis, but people on the ground say it will make a significant dent, at the very least, in the demand that's there, and it will provide some assistance to Indian authorities who are still grappling with this enormous catastrophe.
Well, the Minister for Immigration held meetings with the Indian community. Did the government, they did that today, did the government underestimate the backlash?
Yeah, there's been quite a furious backlash, and interestingly, it was less on the actual ban itself. The response from the Indian Australian community, broadly speaking, there are of course always exceptions, was generally pretty accepting when it came to the actual flight ban or the flight pause. Most Australian Indians, at least those that we spoke to, said that they understood the rationale. But then the subsequent decision a few days later, in the wake of that loophole emerging, to actually impose hefty fines, at least in theory, and potentially even jail time on those who broke the travel order, that seemed to really strike a nerve in the Indian Australian community. And that's why some inside the community, not all, but some, have been accusing the federal government of racism, saying that this is a heavy-handed and really unnecessarily punitive approach. Now, the Immigration Minister, Alex Hawke, and other government members have been at pains to deny this, and Alex Hawke has been holding a series of roundtables too today with a number of Indian community members, trying to explain the government's rationale and to try and drain some of that anger. And he's been giving a couple of interviews saying that there was a level of understanding in the room, at least after that rationale was laid out. But it's worth observing here that even if there is a level of anger in the Indian community in Australia, that sense of dissatisfaction isn't necessarily shared by many other Australians who have consistently, when they're asked, said that they're very comfortable with the government's current settings. Most recently, a Lowy Institute poll from earlier this week found that only 1 in 3 Australians felt that the government should be doing more to help those overseas. And so the government, whilst perhaps it is a little bit taken aback by the strength of the backlash from some in the Indian community, seems to feel that, more broadly speaking, it's on pretty stable electoral ground, and most Australians back the course of action that it's taken.
Stephen, thanks for the update. And you're watching a special edition of The World looking at the COVID catastrophe playing out in India. Journalist Barkha Dutt has been on the front line reporting on the impact of COVID on everyday Indians. But last week it became all too real and very personal when she lost her father to the virus, and she joins us from New Delhi. Barkha, firstly, our deepest condolences. Your father's last words you've reported were, "I'm choking, please give me treatment." The system failed him at so many points along the way, did it not?
Thank you for having me, Beverley. And yes, the news did come home quite literally in the worst possible way this past week. My father, crushed as I am, I'm haunted by the image of ferrying him to hospital in a private ambulance. There's such a scrum. The health system is so under pressure right now that I had to organize a private ambulance to take him to an otherwise excellent hospital. And that ambulance ended up being a rickety old van which had an oxygen cylinder that did not work, a paramedic that did not exist, just a crew of 1, a driver. So by the time my father reached the hospital, his oxygen levels had plummeted to a dangerous level. He was taken into ICU and he never made it back. Though this moment of loss is absolutely crushing for me, I want to say, Beverley, that my father was actually one of the lucky few. It sounds weird to say that because he died and he didn't make it back from the ventilator I had to take the awful decision to place him on. But at least I was able to provide him an ICU bed, a private hospital, and a team of excellent doctors. That is unlike the hundreds of thousands of Indians who are battling this catastrophe today outside the closed doors of emergency wards that do not even have oxygen. Forget drugs or forget other highfalutin treatment. They do not even have enough oxygen to be able to admit more patients. So while my father suffered and my heart broke with it, I am mindful that I was luckier than most, that my father had an opportunity to at least fight for his life for 5 days. And many Indians are dying not from COVID, but because the health system has been betrayed by a monumental series of policy mistakes, incompetence, callousness, ignorance, and even now, the wrong decisions.
So take us through what you believe, Barkha, in your reporting of this and what you've seen so consistently. What is the weakest point in the system right now?
The weakest point in the system is that it has been a fortnight of crisis wherein we cannot get oxygen to our hospitals. So, we aren't even at a stage where we can talk about vaccinations or border policies or mutant strains. We are grappling with survival. We have seen at least 5 incidents that I have personally reported on where we have lost patients in ICUs across cities in India, major cities, I'm not talking about villages, where the oxygen supply has been interrupted to hospitals. And you've seen in one night, 25 patients, 20 patients, 12 patients, sometimes in children's hospitals, sounding the SOS, hospitals taking to social networks saying, please give us oxygen. A court in India has now had to declare that the denial of oxygen to hospitals is equivalent to an act of genocide. That is the situation that we're dealing with, juxtaposed with the fact that at a time when our vaccines were the only way out of this pandemic, our government did not purchase enough vaccines to see us through this period. It misunderstood, misread the second wave. It gifted away and exported vaccines instead of ordering vaccines for our own people. And so our vaccination rates are at its lowest levels ever in this period when they need to be the highest. These two twin catastrophes are simply meaning that people are dying on the streets, literally on the streets, and places of worship like gurudwaras, which is a Sikh place of worship, have now had to start what are called oxygen langars. Langar is a Hindi word for a banquet where you feed the hungry. Instead of feeding food to the hungry, we are now feeding oxygen to India's oxygen-starved citizens. This is the worst end of the world apocalypse that you can imagine. And it is all happening in an unprecedented emergency that I think our government is still not telling the truth to our citizens about.
And that's what I'd like you to focus on for us. Is there any sense that you're getting that the government, the central government understands the crisis? The Supreme Court might order that oxygen needs to be supplied, but if there is no scaling up this issue and organisation from within, will it ever be overcome? How do you see your way through this?
I'm personally calling for the military to take over the deployment, the logistics, the supply chains. I think we have watched the government do it and fail at it. We have watched an absence of coordination between the centre and the federal governments. It has not happened. Every single doctor I have spoken to is saying that they are distraught. They did not sign up to be doctors, so that they had to go around hunting for oxygen cylinders and lose lives because oxygen was not available. I think the government has to acknowledge its failure and hand over the deployment and the crisis response to the military. That would be my personal opinion. I think we have waited long enough. We cannot play with the lives of Indian people anymore.
Barkha, you make it very real for us. We so appreciate your time. Thank you.
Thank you for having me, Beverley.
Well, as the coronavirus situation worsens in India, the country's media has also been hit by accusations of censoring the true scale of the emergency, something that really continually seems to be brought home. Officials unhappy with negative reporting of the deteriorating health situation are reportedly demanding social media platforms like Facebook and Twitter take down certain posts, and some say it's leading India down an increasingly dangerous path. This report by Andrea Nierhoff and producer Sean Manteso.
On April 17, India reported almost 235,000 new coronavirus cases. The same day, Prime Minister Narendra Modi was addressing a crowd at a political rally, one of many held in West Bengal. The mood is jubilant and few people appear concerned about social distancing. Just weeks later, and it's a very different scene, with India in the midst of a COVID disaster. New cases are surging, and critics are rounding on Mr Modi and his government for holding rallies while numbers were spiking and setting a bad example for the rest of the nation.
Complete mishandling and the inability of the government to anticipate the ferocity of the second wave of the COVID-19 pandemic.
But the government isn't taking the criticism lying down. In fact, it's ordered some posts critical of its handling of the crisis to be removed from some social media platforms. Public data can reveal at least 52 tweets were removed from Twitter for violating Indian laws designed to prevent the spread of false information and hate speech. One of the tweets blocked was from opposition MP Revanth Reddy. In the tweet, he uses a hashtag Modi made disaster and says the healthcare system is on the verge of collapse. In another removed tweet, West Bengal Minister Moloy Khatak blamed the Modi government for exacerbating the disaster by exporting millions of vaccines.
If you block that person or that person's account or that person's posts by itself, it not only brings direct censorship in which that information cannot spread. Secondly, it also creates a level of fear in people that they may be subject to censorship or they may be even subject to criminal prosecution.
In fact, someone who had put out a tweet asking for help, I think not being able to get oxygen cylinders in the state of Uttar Pradesh, someone's filed a case against them for spreading misinformation.
Posts on Facebook calling for the resignation of Prime Minister Narendra Modi were also temporarily blocked. Facebook later reinstated them and said it was investigating how they were removed. The bullish campaign by Modi's government to push back against negative media campaigns has even made it to Australia. The Deputy High Commission sent this letter to The Australian over an article that was highly critical of the government's handling of India's second wave. The letter describes the article as baseless, malicious and slanderous. The scale of the censorship is overall relatively small, but Modi's government has been criticised for bringing in new laws to regulate social media and for being increasingly quick to censor media it doesn't agree with. India is now ranked a dismal 142nd in the Press Freedom Index, and many fear what may come next.
Given the increase in censorship and increase in power of the Indian government, we seem to be heading down the road that China traversed in the early part of the century. And that's going to have terrible repercussions for India's democracy.
Andrea Niehoff, ABC News.
Well, among the most vulnerable since the pandemic started are the urban poor of India's cities. Day labourers and migrants from rural areas live in closely packed living quarters with little to no financial safety net. One NGO, Apnale, which focuses on the largest slums in Mumbai. CEO Arun Kumar joins us live now. Arun, good to have you with us. Just how bad is the spread of infections in a slum like Shivaji Nagar, for example, the largest slum in Mumbai?
Thank you for having me on your program. I think, 50%, nearly 50% of Mumbai's population lives in slums. And the infection since last year has been quite bad. In M East Ward, where Apnale works, close to 80% of population lives in informal settlements, which is locally known as slums. Since last year, there are two types of data that have been kind of missing from the entire narrative. One is district-wise or ward-wise data of testing. We have aggregate data for the entire city. Same is the situation even in terms of vaccination. We have entire city's data, but we do not have data at the district level or ward level. Given the huge inequalities among all wards, there are 24 wards in Mumbai, it doesn't help to develop any kind of granular strategy in the absence of data at the ward level. That's point number one. Point number two, I know that areas where primary health care is either weak or missing, people have struggled since 2020 to meet the requirements. We worked with close to 10,000 families last year. And of all the pregnant women that we worked with, 38% left Mumbai for their native places, because this is mostly migrant population, because they were not sure whether they would meet the delivery related needs or healthcare. That's the kind of situation we are talking about. And in the second surge, as you know, things have been very, very bad, both at the medical front and also at the relief and social security front.
Yeah. Did the government provide any financial support to this group of people, these women, these migrant workers that were forced to, as you say, go home back to their sort of their regional areas?
The government has announced various welfare schemes. The interesting thing about India is that, and especially in urban areas, there is a huge chunk of population that remains unenumerated. They're not counted. So the last census that took place was in 2011. And at that point in time, about 2.3%, which would be roughly 3 crore people, 31 million people, who were not covered, who could not be covered in the census, and therefore they do not exist in the government register. So any welfare schemes that the government may have announced will not reach these people. Now, 31 million people, I know in the context of India or China, it's a small number, but I was just told that about 149 countries in the world have less population than 31 million. So that's the kind of mass of people we are talking about who do not have any kind of safety net. And that's point number one.
Sorry, Arun, yes, yes, carry on.
In the local area where, in the slums, in the informal settlements where we work, 4% people do not have any paper whatsoever. So to avail any kind of government schemes, you need to have one of the 8 identification documents that the government has announced. Now, if that kind of people remain outside, say, for instance, food security that has been announced, at least for 1 month, everyone with a ration card should have access to free food. But about 25.3% people where we work have no ration card. So they cannot avail that food. So the point is that even when their government welfare schemes announced, not everyone and the most marginalized are unable to avail those services.
Yes, and I mean, you're talking really, if you're not accounted for, you are not given basic human rights, and so often it's the women and children who suffer the most. Is that what you're seeing when you examine this?
Absolutely, absolutely, that's correct. Since 2005, overall trend of women's participation in labor force has been declining. It has further declined in the last 12 to 13 months because of the pandemic and the lockdown. Now, there is no pan-India number available in terms of the overall impact. But what we do know is that about 39% of people who had left big cities, metropolis, in the last migrant wave that left cities, 39% of them have not been able to get their jobs back. And the majority of those 39% are women.
That is just
so they are the ones who have been pushed out of the labor workforce.
Yeah.
As it is, their percentage was quite low, but it has gone further down in the last 12, 13 months.
So when you look at that lack of accountability for so many people, would you think the figures that we're hearing out of India are actually far worse than what the government is telling us in terms of infections and even deaths?
Unfortunately, we'll have to agree with that. In terms of death, for instance, India, the official figure is about 3,000 people dying every day. But there is, if you look at the number of people who are, given certificate of death due to COVID-19, that's far less compared to the people who are declared due to suspected reason, suspected due to COVID-19, that number is larger than the actually determined number of COVID-19 related deaths. That's one. If you look at the numbers from burial grounds and crematoria in the country, now this has become, unfortunately, a kind of near consensus that those numbers, unofficial numbers, are much higher than what we hear from the government quarters in terms of the total number of people who have lost their lives.
A tragedy as it continues to unfold. Arun Kumar, thank you very much for your time.
Thank you for having me on the program. Thank you.
While Australian cricketers are also having a tough time getting home from India, some English players, though, have already secured flights back to the UK. Now, there are more than 40 international players currently stranded in India after the suspension of the IPL, and the logistics of getting them home is proving to be quite a challenge.
Just last week, this was the message from IPL players to Indian cricket fans.
We hope everyone is staying home and staying safe.
Stay home and stay safe.
Stay home and stay safe.
Now those same players are scrambling to get home and be safe. England's Joss Buttler, New Zealand's Kane Williamson and South Africa's AB de Villiers are just some of the international stars caught up in the crisis. But some are finding it easier to leave India than others. If you're Australian, you're currently banned from returning home. But British nationals and residents can fly to England, then do 10 days hotel quarantine. New Zealand citizens can also fly home, but have to spend a total of 14 days in hotel quarantine. And South Africans are allowed back, provided they return a negative COVID test before departing.
At the moment, the IPL franchises and the BCCI are putting travel arrangements together. It's the responsibility of the BCC and the franchises to get the players home safely.
Another problem is finding a plane. Dubai is a common stopover on long-haul flights, but the UAE has banned arrivals from India, including those who are just transiting. New Zealand's contingent has a further complication. Several players are supposed to be heading to England for next month's World Test Championship final. They're trying to see if there's a way they could head straight to the UK.
They're all pretty anxious now with what's happened in the last 24, 48 hours. So the logistics of getting them back to New Zealand or the group to the UK is a real challenge.
Then there's New Zealand's opponents in the WTC final, India. Players in the national squad will also have to make their way to the UK. For now, the International Cricket Council says the showpiece event is going ahead. It's due to be held in Southampton on the 18th of June.
Well, as we know, the second wave has spread beyond India's borders. Its neighbours have also seen their infection numbers skyrocket, reporting the presence of the double mutant strain that's been blamed for the crisis in India. Well, let's get an understanding of that flow-on effect. So we're joined by Professor K. Srinath Reddy, an epidemiologist and president of the Public Health Foundation. Lovely to have you with us, Professor Reddy. Before we move on to the regional impact, where in its trajectory do you believe the second wave is in India at the moment?
Well, we'll have to look at India as a whole, then look at different parts of India. There are several places which entered the second wave earlier than others. Some of them are showing a decline, and they might maintain the decline. Others started the surge much later, and some have actually started the surge in the last few days after the mass meetings and elections and so on. So we are going to see different calendars in different parts of the country. However, if you take the country as a whole, it is likely that after the 15th of May, we will possibly start seeing some decline in the cases and the daily case count, provided we take strict containment measures now across the country.
And do you think those measures are being... Do you think those right measures, though, are being taken to contain it at this point?
Well, some of the states have gone into full lockdown. Some have gone to near lockdown. Others are managing, even with rising cases, without too much of a strain on their healthcare system. Like, for example, the states of Kerala and Tamil Nadu are managing quite well despite rising numbers of cases. Some others have deferred lockdown, but now I believe they're looking at either stricter containment measures or a lockdown itself. Indeed, there is some expectation that the national leadership also will be addressing this issue through a possible countrywide lockdown. We'll have to wait for the Prime Minister's announcement. But there is definitely a move for a coordinated countrywide containment strategy, maybe with some variations on the theme across the states.
Let's talk about the regional spread. We're seeing neighbouring countries report a big spike in infections. Do you think that this is inevitable because of the second wave that's so deeply affecting India?
Well, it's true that borders are porous, whether it is between the Indian states or between India and the neighbouring countries. And with a fair amount of movement that has been restored after early January, when it was felt that India was out of the woods and was unlikely to see the second wave, which was a mistaken assumption. I think travel was quite unrestricted and in full flow. And that has given the virus as well as the variants a highway to travel without any challenge.
So,
So the neighbouring countries are likely to be affected, yes.
Yes. When you see countries like Australia decide to stop travel and restrict travel from India into Australia, despite the fact that we have many Australian residents stranded there, do you think that is the right decision?
Well, for the time being, they may take the decision which they feel is most appropriate to prevent the virus resurfacing or for the variants to enter which they have not previously encountered. Therefore, I believe it's for them to take the decision as per their assessment of what the danger that travelers pose. However, we must also recognize that this is not a unique situation. After all, when the Kent mutant arose in Britain, the B117, some of the European countries banned travel. And we recognize that even the first variant to enter in India and is still entrenched in some parts of India as a growing threat is still that particular mutant. The other mutants have also arisen in India. So we are going to see during the course of the pandemic, several variants arise in different parts of the world and possibly cross boundaries. While temporary restrictions of travel may be necessary and possibly will be applied, I believe the important thing is for us to demonstrate global solidarity and try and ensure that we work together as closely as possible to contain the common pandemic threat. So I believe locking out countries for long is not going to be a realistic solution.
Yeah. Tell us about the impact this is having on vaccine supply in India. You know, India is such a hub for medications globally. How is this going to impact supply?
Well, as far as vaccine supply is concerned, I don't think the production itself is going to be restricted, provided all the essential raw materials which were previously restricted from the United States come back in full flow. Because the vaccine manufacturer, drug manufacturer, as well as PPE manufacturing declared in the very beginning of the pandemic to be essential industries, and they will be prioritized for transport as well as for permitting workers to attend the factories. Certainly, there will be some dip initially when the lockdowns are going to be stringently announced, but I think soon that will settle down. Where I believe we are going to see the challenge is in looking at how best the vaccines will act against the variants. Fortunately, we have some good news now that at least the two variants that are most in circulation now in India, that is the B117, the Kent variant, as well as the one discovered in Maharashtra, that is B1617, seem quite responsive to the inactivated virus vaccine that's been developed in India, that is Covaxin, and also seem to be responsive to Covishield, which is the AstraZeneca vaccine being produced in India. We still do not know what the impact is going to be against the variant that has been discovered in South Africa, which has been reported to escape the protective effect of the AstraZeneca vaccine. The current vaccines available in India also seem effective against the variant found from Brazil. So at least the situation is not hopeless from that point of view. The vaccines seem to be effective against the original virus as well as the variants, but we have to keep a guard against the fresh variants arising.
Yeah, indeed. Well, at least a little bit of hope on the horizon. We do appreciate you joining us, Professor. Thank you so much.
Welcome.